The COVID-19 pandemic is a growing challenge worldwide. 6 months after the coronavirus appeared in America, the nation has fallen way short in containing it. The Johns Hopkins tally shows more than 3.7 million confirmed cases, at least 140,000 deaths already. How did the world's richest country getting into this dismal situation? Is it indeed a tale that unflinchingly explores the flaws and fissures in a nation long proud of its ability to meet this challenge? Let's ask our panelists. For the latest on COVID-19 of the United States in Los Angeles, we're joined by Sean Nassary, who is a Harvard-educated and Mayo Clinic trainer here for nose and throat doctor. In Seattle, we have Dr. Robert Morris, a physician and environmental epidemiologist. In Nashville, Dr. William Schaffner, professor at the Vanderbilt University School of Medicine, and in New Haven, Xi Cheng, associate professor of health policy and economics at Yale University of Public Health. I want to welcome the four of you. Sorry to hear about the latest news regarding the daily cases, confirmed cases of COVID-19 in the United States. What do you make of the reality, Dr. Nassary?
Well, unfortunately, I'm on the West Coast in California, and several states along the South and West have seen a huge jump in the last 3 weeks. We've seen a tremendous increase in activity, as especially young people have had fatigue from the quarantine and have been out. So we're seeing our ICUs and our hospitals starting to fill across California, Arizona, Texas, Florida, and into New Orleans. And we're seeing a big jump in cases of hospitalized cases in addition to diagnosed cases.
Mr. Morris, earlier when we listened to Dr. Fauci talking about 100,000 new cases every day, people were suggesting, is it possible? But it's really just around the corner. So what does that mean for the pressure for treatment and also prevention and control inside the city? Or inside the country, sorry, sir.
I think there was a sense that we could, we had stopped this, we got it under control, and we were just going to go back to normal. And there is no normal to go back to, and that's really clear in what's been happening in the United States.
Dr. Schaffner, tell me more about whether when politics can be a bit cleared up. We heard from your president today that he is going to start a daily briefing and he himself going to participate in it. We also saw him claiming himself as a patriot, wearing a face mask and with a photo in his tweet. Do you consider that as politics a bit cleared already on the road for the real signs to come in?
Previously, when we had outbreaks of disease or infectious disease threats, they were led by public health authorities and our premier public health agency, the Centers for Disease Control and Prevention, the CDC, and our political leadership supported the public health authorities. This has been reversed. In our country, the politicians have taken the lead, particularly at the national level, and unfortunately, we have not had a national plan. The national leadership has given it to the various state governors, and so we have 50 different programs across the state. And so it's no wonder that the average person is really quite confused, because we have heard very, very different messages, sometimes even in the same news conference that comes out of Washington. And so every state governor is now trying to find their way to try to control COVID. I think basically the New England states and New York have it under somewhat control, but the rest of us are really struggling. The virus continues to be ahead of us.
If I could just follow up, do you think with the two presidential candidates, Dr. Schaffner, claiming that they're going to have COVID-19, the pandemic, as the top priority in their campaign, do you think that's going to help or the other way around? Dr. Schaffner?
Well, I would prefer to hear public health authorities speak about COVID and the plans that we have. Of course, our political leadership and the contenders will be making this part of their campaign because it's such a dominant national and indeed a global problem. Whether the public will take encouragement from that or will be further discouraged because a lot of what is said will be placed in political terms rather than in solid scientific public health terms.
Right.
I really wish that the public health leaders could do most of the communication to the public.
Well, as they say, the best and the smartest politician usually would step aside and create all the circumstances for scientists to do the right thing at this moment in the public health crisis. But maybe the reality is a little bit far from there. Dr. Xi Cheng, we've been talking to you on and off many times. Now, your observation since our last talk, your update.
Since then, both parties have been coming out with proposals for additional funding. But I think, first of all, we need to fully understand the virus is the enemy, not the public health measures. Although public health measures may have some negative impact in the very short term in terms of economy and reopening, but it will treat the root cause instead of the symptom. So far, I think the CARE Act and other stimulus packages coming out of the Congress are more treating the symptoms. They are subsidizing those people and the firms, but they are not tackling the basic, the fundamental question, how we need to make the economy run again and reopen.
Right.
So that the most important issue is to address the virus. Otherwise, there's no returning of the confidence and there will be uncertainty there.
That is an interesting question. Dr. Morris, we've seen earlier, people were trying to shape the issues as public health and the quarantine vis-a-vis the health of the economy. Now, do you think that thing has changed inside the United States? What do you think would be the overwhelming public sentiment now as a result of earlier months of twists and turns, and as a result of more people realizing politicizing the issue will not help?
I think it's very valid for there to be a serious discussion about the economic trade-offs of various public health measures. But that's not the discussion we're having. It's a discussion as, when the president's spokesman is saying, we're not going to we don't want the science to get in the way of going back to school. It's completely missing the point. Science has to underlie what we're doing, and then we can have a conversation about how we mitigate the impact on the economy. But the fact that this has been, as Dr. Scheffner said, it's been so politicized an issue. When the simple act of wearing a mask becomes a political issue, you are radically undermining the ability not only to control the pandemic, but to get the economy going again.
I've been talking to a lot of Chinese public health officers or doctors on the front lines, and the thing that they've been telling me when trying to understand what's going on in your country is it's sympathy toward you, their counterparts, about the fact that you've been trying to speak out and you've been working your way to your professional standards, but still the society has not turned around and understand this.
I think absolutely. I think Dr. Morris hit the nail on the head that a lot of our public is still confused because of the politicization of the message that we're going into fall. We're looking at the biggest event for fall, which for most of us with children is children going back to school. And we're trying to do it regionally and locally with most communities with the science of how do we get kids back in school. Younger kids have an impossible time learning by Zoom. Older kids do much better with it, but it's still that socialization that's required. But how do we apply that science in terms of cohorting kids, making sure that they wear masks, making sure that they have social distancing at school. And in different parts of even California, where we have 40 million Californians, we have seemingly 100 different ways of opening our school districts. And that needs to be consistent, and that needs to be back to the science of how do we protect our children as we reopen the economy.
There is one issue about age. Now, we have seen over the past few months, younger people tend to have safer possibilities in this pandemic, but we have also seen the younger people's confirmation cases have been rising, even though many of them are asymptomatic. Are we going to see age conflict among different age groups about what's the right thing to do?
Well, I don't think we've seen age conflicts, but we certainly see differences in behavior according to age and underlying chronic illnesses. Older persons are still sheltering at home, being much more careful, whereas younger people are going out, they're much more carefree, I would even say careless, not wearing masks, going to bars in large groups, and they recognize that they're much personally less apt to be not apt to be infected, but less apt to be seriously ill. What they've forgotten, of course, is that they can transmit this virus. It's not just about them. They can pass this virus out to others because it's so contagious. So we do seem to have, by age, if you will let me generalize, two different sorts of populations with different sorts of behaviors. Older persons more careful, younger people more carefree.
We see very different approaches in terms of individuals, in terms of institutions, in terms of states and localities about this pandemic. Now, more than half a year into this, Dr. Morris, what do you think people have learned about these apparent differences, but actually a consensus maybe should be the next step?
Yeah, I mean, we got thrust into a very strange situation because everybody in public health looks to the CDC, not just in the United States, but internationally, has looked to the CDC for leadership in addressing a pandemic like we're experiencing now. Nobody has got more experience than the CDC, and to see them shut out of this process has been stunning. And I think part of the early peaks, particularly for the one in Seattle, happened in part because the CDC was sort of not there. The states were suddenly realizing in the middle of the pandemic, they were realizing they had to figure this out on their own.
Yeah.
And that's a very new situation. I mean, Washington has a very good State Department of Public Health, but we're not, they were not used to dealing with this kind of a pandemic independently and coming up with their own response and strategy. And so the lack of an effective, coordinated, science-based federal response to this has been devastating, and it's the real reason that we're seeing this tremendous disparity where the Northeast actually has this under control, and places like Arizona and Texas are in serious trouble. And Washington has its own challenges right now. We recently had our highest number of daily cases.
I know.
So it's not good.
This is not good. We all know that. And it is not about the United States. It's really about everybody. If the U.S. can't clear it, other countries can't clear it, nobody can clear it. So this is likely to be a very sustained battle we're talking about globally. Having said that, though, let's come to the last question, which I also believe, after talking to scientists and public health experts for half a year, extremely crucial international cooperation. This is not an empty phrase. This is about our lives and about our health. So how much really, whether it's therapeutic treatment, whether it's vaccine, whether it's policy alignment, whether it's platform building, have we seen, doctors and also professors, over the past few months about public and international cooperation?
Absolutely. I'd like to build on what Dr. Morris said because he made an excellent point about federal coordination. And we've seen that tremendously so in terms of supply chain, especially for hospital supplies and personal protective equipment. And that's where we've seen a tremendous amount of international cooperation that literally in California, the majority of personal protective equipment has not been coming from our federal government. It's actually been through excellent cooperation with companies in Asia who've really stepped up to meet that demand for the western half of the United States and much of the United States in terms of providing N95 masks, face shields, personal protective gear, because these are all measures that unfortunately, as we hit into 50 separate, disparate areas with different health benefits, state-run health programs, that we were very much short in much of California for personal protective equipment. And that's where the international community really came together. And we've seen, as odd as it seems, people from the movie industry, people from the fashion industry, people from food import industries have really stepped in to help with import of personal protective equipment and hospital supplies when those through our traditional suppliers have very much run short. If you look nationally, and that's been a huge measure that especially through Asia, China, Korea have been a tremendous help for physicians, hospitals, and health systems.
I see. What about international cooperation from your perspective, Dr. Schaffner?
Well, just as Dr. Nassari said, there's been a great deal of international cooperation. I think the public health people would like to cooperate even more. I must say that our national leadership, which has just started the process to withdraw from the WHO right in the middle of a global pandemic, has actually shocked many of us. That's not exactly a plan for international cooperation. I think much of that goes on an individual basis, and we would like to do much more because we can't all go on by ourselves. We need collaboration. And once vaccines, and we all hope there will be vaccines, come on the line, we will all want to cooperate to distribute those vaccines in an equitable way around the globe so the entire world's population can benefit from them. That will take a lot of diplomacy.
Yes.
I don't see the groundwork for that being laid quite yet. We need to start.
We need to start immediately. Dr. Xi-Cheng, we know that the United Nations, crippled by the geopolitics, has not yet been able to even start a Security Council meeting or a resolution about the COVID-19 so far, despite of the fact this is the biggest global threat we are all facing today. So, Dr. Xi-Cheng, what kind of platform do you think, following Dr. Schaffner's answer, need to be quickly established?
I think strengthening the WHO and other international existing corporations and entities will be a more immediate solution because they already have established the capacity linking the global community. But in my view, in order to achieve this, I think in the US, within US, there should be first a demonstration about unity within the US between the two parties and between the central government and the local government. I haven't seen this without a domestic unified efforts towards fighting this virus outbreak. It's hard to say the international collaboration.
That's a great point. Lastly, before we go, Dr. Morris, your take about that.
Well, you know, scientists are actually very used to international cooperation. And I guess I'd have to say one of the bright spots of what's happened in the course of this pandemic is the extent to which the international scientific community has really drawn together and shared information and shared resources in a way that I find quite stunning. I have never seen science happen so fast and you know, with such a coordination and a collaboration of efforts as it has around this issue. So, you know, it's as long as we can have the government listening to what the scientists are saying and recognizing the value of the kind of openness and honesty and sharing that goes on in the scientific community, maybe we can find a way to deal with this.
We hope that will be the case. Thank you so much for the four of you sharing your insights with us. All the best, and thank you for your service. Dr. Sean Nassari, Robert Morris, William Schaffner, Xi Chen. Really appreciate it. Be safe.